Data and research have been vital tools in the state's response to coronavirus. Because COVID-19 is a novel or new virus, analysts have had to rely on modeling to predict just how wide it can spread and how much stress it can put on the healthcare system. State House correspondent Andy Chow sat down with an analytics expert to talk more about modeling.
Dr. James Simon is medical director for enterprise analytics at the Cleveland Clinic. He's part of the hospital's effort to track COVID-19 through modeling. Simon says modeling is the combination of math, research, historical data, and assumptions to make projections. In this case, as Simon puts it, trying to predict the future spread of coronavirus.
There are a lot of different ways to do it. And so you're going to see, you see a lot of different models out there, even within Ohio. And they all start with, you have to start with what you know, and then you make assumptions. And the assumptions should be informed by prior experience. So if we get a flu infection and flu season comes around, we know how flu tends to act. When we had the flu pandemic, we had prior flu pandemics, so that we knew how that acted. Well, we've never seen a coronavirus pandemic. So the assumptions we have to make to plug in those equations are, we don't have good data on that. And so we have to use assumptions based on other pandemics, and that's where some of the errors come in, some of the variation.
Cleveland Clinic used what's known as the SIR model, determining who is susceptible to the virus, infected, and who's recovered. Simon says these models can vary but become more accurate as they progress.
When that hurricane's up far off the coast in the middle of the ocean, it just forms. You see the European model, you see the American model, and all these other models. Some of them show it going into the Gulf, some of it show it going up the East Coast, and some show it turning off and going back into the ocean. As it gets closer and we build up experience with how that hurricane is acting, the models start to come closer together and everyone starts to agree. That's exactly what's happening here.
The Cleveland Clinic has different models going on at the same time using different assumptions, including how much social distancing and other mitigation efforts have been implemented.
That actually comes as a factor into the model. And what it does is it basically slows down how the virus spreads and it decreases the number of people it infects. So that's what we call dampening the curve, right? Instead of having this big ramp up where the health system gets overwhelmed, it decreases the peak of that curve and spreads it out over time so that the healthcare system can handle the patients that present all at once.
Although the models from around the state show the curve is getting flatter, Simon continues to say that Ohio must keep practicing social distancing and other efforts to minimize exposure to the virus.
It's similar to what I tell my high blood pressure patients when we use blood pressure medicines and their blood pressure gets controlled and they ask if they can stop their blood pressure medicines. It's not, their blood pressure is controlled not because they no longer have high blood pressure, but because they're taking the blood pressure medicine. And so exactly the same, we're seeing our curve dampen because of everything everyone's doing. The infection is still out there. If we went back to no social distancing, they're very concerned that it could flare up again.
Simon adds that Ohio is able to use data from other countries already hit by coronavirus. He says another warning sign is from countries that let up on social distancing too early, then experienced flare-ups of COVID-19. Andy Chow, State House News Bureau.